continuing on with our wonderful free ALA webinars monthly. And today we've got Dr. Simon Grbevski with us all the way from Sydney, and we're really excited to have him again. It's been a while since we've featured Simon, so we're really happy. I think I'll launch in and introduce you, Simon. So I've heard that you've got plenty of information to present to us. So let me read out your wonderful bio. Dr. Simon Grbevski has been working in the field of optometry since 1976. He is a fellow member of the Australian College of Behavioural Optometrists, fellow of the College of Optometrists in Vision Development in USA, and fellow of the College of Syntonic Optometry in USA. In Australia, Simon pioneered the field of Syntonics, which is a branch of optometry using phototherapy, which is light and colour frequencies, administered to the eyes to treat many visual and behavioural conditions. Dr. Grbevski is the founder and president of the Australian College of Syntonics, having extensive experience in both teaching and presenting live on radio and television, and featured in numerous newspapers. His expertise extends to working closely with optometry for sports people. Additionally, Simon is an inventor and creator of specialised equipment for optometry, syntonics, and light therapy, which is sold and used worldwide, including by USA Olympic athletes. And in 2005, Dr. Grbevski was the recipient of the prestigious Harry Riley Spitler Award for Excellence in Syntonic Optometry. So that's really quite a biography, and we're very fortunate. Today, Simon will be presenting on the topic of sunlight and its role in regulating circadian rhythms. So welcome, Simon. Thank you so much for joining us.
Thank you, Manisha. I don't realise that person. I don't see him every morning. It doesn't sound like me. Yes, so welcome everyone. Thank you so much for that. What I wanted to start with is actually a poll, and if you can all fill that in, what it'll do, it'll tell us what particular character you have, or what we would call a chronotype. Okay, so if you can all fill that in now, and we'll get the poll a little bit later on. I'm going to share my screen and start the talk. Now, while you're testing your memories there, it shouldn't be too hard. Okay, so what the purpose of the questionnaire is to see which of you are either a lark, an owl, or a hummingbird. What are those names relate to? A lark and an owl are traits influence many aspects of your daily life, including when you feel the most alert and when you feel best to have a sleep. These are called chronotypes, or part of your biorhythm systems. These traits determine when we most enjoy meals, exercise, sex, and other activities. They also affect when we choose to work, or would, if we could, choose. So the first one, the larks, they're up at dawn, raring to go. They're the early birds, okay? And the owls, who enjoy staying up late, past midnight, and don't like getting up early in the morning. All right, and the rest of those in the middle, we call them hummingbirds, and they're ready for action both early or late, so they can fit in between those anywhere. So they can, but also they can be a little bit more larkish or a little bit more owlish, so they can tend to one or the other. So, as I said, let's see if your behaviour accurately fits your chronotype. So you know who you are. And if you're one of those, let's see what by our talk, see if it starts to fit part of your behaviours or even your physiology. Okay, so the one thing is that we're photobiotic creatures. What does that mean? It means we need light to live or to thrive. Basically, all life forms, plants, animals, and humans, are photobiotic. And here in Australia, we're called a nation of sun seekers. We love the outdoors. We feel alive and recharged when we go outside. And in springtime, what generally happens, boys' fancy turns to girls. And in wintertime, we start getting the blues and we start inside eating more and putting on extra weight. So these are some of the things. But we need the light to survive. That's what it means. So this is part of the circadian rhythms. The word circadian, pronounced circadian, and comes from a Latin phrase meaning about a day. So things that are happening over the day. These are physiological and behavioural characteristics that follow a daily or circadian pattern. Our bodies display hundreds of these circadian rhythms. A few of the most important are sleep and wakefulness. And then there's body temperature, blood pressure, times of production of hormones, when we eat, okay? These will also change according to the seasons. Morning people are usually those that prefer getting up between 5 and 7 a.m. and they generally retire between 9 and 11. Evening people, these are the words evening and morning people is the scientific words that are being used. So it's morningness and eveningness that relates to it rather than larks and owls, So as we go along, you hear those words change, but that's what they mean. And the evening people tend to prefer both a later wake up, 9 a.m. to 11, and therefore also go to bed between 11 and 3 a.m. Morning people generally are rigid in their circadian pattern, and while the evening people are more flexible in their character of adjusting the sleeping habits. And so biological rhythms, these are synchronized biological functions of our body. They happen in an orchestrated way, like an orchestra, a piece of orchestra. They are the rhythms of our life. An orchestra composed of all the instruments of the universe, each being played at the same time, some playing the same beat, some a slower beat, others a faster beat, but all in harmony. So fast, normal, and slow beats. And each of these wavelengths are actually characteristics of the colours. So fast is your blues, normals around the greens, and the reds are slow rhythms. Okay, so light is one of the biggest influences on our circadian rhythms. And how does this work? So the first stage is when light enters our eyes, it hits the retina, and but a particular area that are non-image forming cells called photosensitive retinal ganglion cells. And these cells have one job, and that is to receive the light and tell us if it's night or day. Once it goes there, part two is that these cells are more sensitive to blue light, and should they not receive adequate light for 2 hours, they will send a message to the particular part in the brain called the suprachiasmatic nucleus, telling it that it's nighttime. So, and then in this next stage, our suprachiasmatic nucleus communicates with the pineal gland, which starts the secretion of melatonin, a hormone that tells the body to start to go to sleep, and triggering the cycles of hormone release, other hormone released for a healthy sleep pattern. So they're the 4 stages in sleep. And then, okay. So in the circadian rhythm, as we said, there are 2 pathways. There's the primary optic, which goes for vision, and there's a secondary non-visual which goes to what's called the retinohypothalamic tract, and this is the one that is controlled by the suprachiasmatic nucleus and the hypothalamus. So and it is a direct path, and light plays a large role in setting the circadian clock. If no light is seen, there's still a cycle in the day, but it tends to be 25 hours, whereas in our normal 24 hours is because of the sun coming up for 24 hours. Blind people even have a circadian clock, but it is out of synchrony, which means that they generally result with having insomnia or like a permanent jet lag. So, light resets the human circadian rhythm. Most visible wavelengths can reset the clock, but the blues do the job with the greatest efficiency. And what other things affect the circadian rhythms is light, the quality, the quantity, and what part of the day that light is introduced. Our temperature of our body, or the temperature outside, any medications, our mood, the cognitive demands that are upon us, stress, sleeping habits, our chronotype, and of course, can't leave medicine out, our genes. So some of the symptoms associated with some health problems with circadian disruption. So there's an increased risk for heart problems, digestive disturbance, and emotional and mental problems. There's reduced alertness, so poor performance and quality of sleep. So some of the depression, sleep disorders, insomnia, weight gain, noise sensitivity, memory loss, immune function reduction, reduced mental function, so there's confusion, frustration, depression, irritability, increased psychotic states, for example, lunacy, when the moon is up and it's a full moon. So paranoia, hallucinations in normal populations, disrupted sleep increases mania and hyperactivity. So disrupted sleep has also been linked to ADHD. So, and with those that tend to stay up late and have a disrupted sleep get cranky and also uncoordinated. So there's reduced efficiency in cognitive functions and motor skills. There may be some hallucinations and, as we said, dysfunctional movements. But the key one is cancer, okay? And because of the melatonin levels being disrupted enormously. So in the cancer part, there was a study of 120,000 nurses. 40% of them had breast cancer. And that was put to the fact that it was they were on night shift for so long. So what types of cycles are there? There's the universal cycle, which means that, that's based upon the Earth's rotation around the sun and comets. There's circadian cycles, which are yearly, like seasons of the seasons, birds' migration, breeding season, aging. Infradian, which is a monthly cycle, like the moon phases, the menstrual cycles. Circadian, which is the daily one we've mentioned, which is body temperatures, the wake sleep cycle, and daily rituals. And ultradian is within the day, biological cycles like your heartbeat, your breath, your endocrine systems, your digestive peristalsis, and any chemical reactions. So biological circadian rhythms are diurnal physiological and biochemical changes that occur throughout our day and our lifetime. So it's not just the phases of the sun, but these are synchronized physiological and biochemical things that happen within us, and such as melatonin and cortisol. At night, your melatonin goes up, your cortisol level goes down because you don't want to be active, you want to go to sleep. Whereas in the morning, your cortisol levels start to go up, melatonin goes down because you want to be ready for action for the day. Hormonal rhythms alternated, as we mentioned, the menstrual cycle is one of those, and of course seasonally, the seasonal changes of these diurnal parameters. So looking at some of these, your alertness, if you look at the graph, the top one, the purple, our highest alertness is somewhere after lunch, later in the afternoon. Our temperature, it fluctuates throughout the day, but it's much higher and lowest during sleep time. Growth hormone, as we see, it's the highest when we're actually sleeping. So the more sleep the children get, the more growth hormones. Similarly with us, the growth hormone is also our lifeline to youth. Cortisol levels, as I mentioned, goes up in the morning and down in the evening, and to the fact that potassium has and sodium levels vary throughout the day. And here's another one. So it's the sleep-wake cycle. You got your eosinophils in the blood, ACTH in plasma, cortisol levels in the early part of the day there, and the body temperature later on. Magnesium, sodium, and all these other chemical reactions happen throughout the day. And we will look at that in science. What we realize is, actually I'll go past this a little bit, is these things were already known by complementary medicine, like the Ayurveda has the Kapha, Pitta and Vata. So they had it within age groups, but also within the day itself. So they knew about these things. And the Oriental clock, throughout the day. So this is the part that I was talking about, the different stages of potassium and your magnesium changes throughout the day. The Oriental clock shows that your body functions, different parts of your body, the organs kick in. So, okay. Now, in here, as we've mentioned, your melatonin is highest in the night, and actually highest around about 2-3 o'clock in the morning. And melatonin is the precursor for serotonin, your happy hormone, and so it's the lowest at night. But as we get up, serotonin levels start to increase and then die off again. So that is appropriate that we feel great in the morning, and when the sun comes down, we don't feel so good. So you can associate this when in springtime, when the sun gets brighter, we feel good. And in wintertime, when there's less sun, we don't get as much serotonin, so we don't feel as good. And this is called seasonally associated depression as well. Okay, so as I said, this also varies in summer and springtime and wintertime. So if we look at that, the reason is that we get shorter days in summertime. So you have less melatonin being produced in summertime than in wintertime, because we have longer nights, and therefore we have that part of it. But it also varies according to gender. And if we look at this, we've got the variations over the season. However, females always produce more melatonin. Could this be why also females live longer? All right. Because melatonin is a very strong antioxidant, anti-cancerous. So anyway, we'll come to that. Light is the cornerstone of health and well-being. A wealth of data published in the past 25 years has demonstrated light can be a potent biological, behavioural and therapeutic stimulus in humans. Most research has been on the photoreceptor system that serves as the input for non-visual neurobehavioural regulation in humans. So, and as we know, natural light varies with the time of day, time of year, and even the place on Earth. So we're going to be affected differently. So like SAD, the further away you are from the equator, the higher the incidence of seasonally associated depression. And humans have been called creatures of a habit. A habit is something we do repeatedly and unconsciously. We have routines or rituals to make us feel safe and stress-free. So as a definition, an act or series of acts regularly repeated in a set or precise manner. Some we have organized ourselves, but there are other habits we do which are unconsciously triggered by our environment. And this is the circadian rhythm, by the day and night, okay? And as we know, most kids need a routine, a habit, and that's why they feel safe and stress-free. So recent studies have shown that most people spend 90% of their day indoors. They're not out in the sun at all. They're in home, the shopping centres, in the workplace, or in their car, always under artificial lighting. John Ott coined the phrase malillumination, light deprived like malnutrition. The irony of modern life is the more advanced our discoveries and inventions we make for a better life, the more the compensations we have to make to support them from harming us and the environment. For example, noise pollution, visual space pollution, signages. We had in the office, our front door is one of those pneumatic ones which slowly closes, and the spring on it broke. And so what would happen is you open it, let it go, and it just slams shut. And we were worried that, some kid would be on the other end behind the mum when she let it go and they get harmed. So we put a sign on the door saying, the door's faulty. And do you think anyone paid attention to it? No, we had to lock the door, literally, before we could do that. It's because there is so much of these signs around us that we blocked it out. There's so much noise that we blocked it out. A lot of the plastic items that we produce pollute our waterways, increase estrogen in our bodies. The carbon fuels destroy ozone layers, changes in earth temperature. GMO foods increase hypersensitivity to food. Hydroponic foods need to, so we need to take vitamins because they don't have the nutrients in them. Bluetooth earbuds will lead to more hearing losses. Electronic little devices create loss of family time, stop us from thinking for ourselves, increase hypersensitivity to electromagnetic fields, having to teach children to creep and crawl and even socialize. They're things that we are facing. Lighting streets, illuminated signs, can't see the stars now. And animals die crashing into buildings, animals stop breeding or breed wrong time, disruption of our biological times due to all this street signage. And if you notice that the new sort of street signs are shining downwards, they're not the open ones like they used to be. So they're paying attention. And there's all these other things. That's my rave about us. I won't go there again. But anyway, let's go back to light again. So daylight has a full spectrum. As we can see on the top left there, it's got all the colors there. In sunset, what we can find is we have more of the reds. Incandescent lights mimic that, whereas LEDs, we notice there's a huge spike in the blue end. And there's been so much talk about the harm of blue light because it disrupts this circadian pattern is one of the things. But we need blue light because it improves concentration and attention. So if we look at fluorescent lights, they've got all these peaks, so they're missing a lot of the other colors, and same with cool. Okay, so reiterating, circadian rhythm is not surprising that sunlight has such a strong effect on the way we feel. Light is the most important Zeitgeber or regulator of the circadian rhythm. Our body's master clocks, special receptors in the eyes, as we said, transmit signals to the master clock that in turn regulates your sleep-wake cycle, your metabolism when you should digest and eat. So you shouldn't be eating middle of the night, and you shouldn't be paying attention to things at night as well, so your alertness and so on. So work on circadian rhythm even received a Nobel Prize in Physiology and Medicine in 2017. So it shows how important it is. So light regulates multiple non-visual circadian, neuroendocrine, neurobehavioral functions and conveys a strong stimulating signal for alertness and cognition. So as I said, in the morning, we need more of the blue light to suppress the melatonin, but what it does is increases your cortisol so that you pay more attention. And circadian rhythm is regulated by a gene translation or transcription feedback process that synchronizes biological systems with the environmental light. There is a potential adaptive advantage of timing behavioral, metabolic, and developmental processes to the appropriate phase of night and day. So it's important they are synchronized. When we start to disrupt that, it starts to pay. We start to pay severely. So the circadian rhythms is actually the body's has to anticipate what's going to come next. So most organisms do not merely respond to the environment, but have the capacity to the physiology and behavior in anticipating a changing environment conditions. So the circadian rhythms are preparing your body for the next thing that's going to happen. So it's anticipating something to happen and change. And if it doesn't, then it gets confused, and obviously it starts to create problems. So, so this is where we can advance this timing by staying up later, using the electronic mediums, or just having the artificial lighting on, and not waking up in time in the morning. So that anticipation needs an entrainment pattern, and we can shift those by the different type of lighting environments that we have. Now, we've all heard about biophotons. What they are is light that our body emits, and it's a light that's about 1,000 times fainter than our human eye can perceive. And there are special cameras these days that can detect this light. And what they have found is that the light, the biophotons that we emit also have a circadian rhythm. Okay. We found that in this particular study, we found that the human body directly and rhythmically emits light. The diurnal changes in photon emission might be linked to changes in energy metabolism. So as our energy levels change throughout the day, so does the number of photons that we emit. So this is the study that it went. Patient was laid in the dark, and they took photos of them throughout the different parts of the day. So 10:30 a.m., 1:30, 4 o'clock, 7 o'clock, and 10 o'clock. And we see the difference intensities of photons that happen. And the one we notice is around 4 o'clock. Okay. And why should it be happening at 4 o'clock? And if we look at our biological changes that happen throughout the day, okay, so at noontime, we have best coordination. Before that is the highest alertness. This is when school kids, teenagers, should be starting school, because that's when they're really awake. But in this study, the highest activity part is between 2:30 and 5. So our brains, our fastest reaction times, our body coordinations are high. So this may account why our photon emissions are highest at that time, because we're highest action. And here it is again, the changes. And the photon emission and cortisol levels are in direct opposite relations. So as cortisol goes up, your photon levels go down. As our photon levels go up, your cortisol levels go down. So it means as you're more relaxed and in harmony. So relationship between light, sleep, and obesity. Okay, so overweight, what we've noticed is our weight levels are increasing over the last 40, 50 years. And what also has happened is our sleep time has reduced. So there's this pattern of behaviour that's happening as the more we stay up, the more chance that we eat at the wrong time, eat the wrong foods, and obesity increases. In another particular study where the body was exposed to light, the earlier, or actually a wake-up time of the person, the earlier this light exposure occurred during the day, the lower the individual's body mass index. So what that means is that if you are an early bird, a lark, your tendency is to have not be obese as much, because that morning light has specific functions on your biology to lose body fat. Okay, and with the owls, because they stay up late, their tendency is that they do put on weight a bit more. Okay, not in all cases, but it's a sort of a tendency. So the poor sleep leads to poor health. Circadian rhythms, misalignments, and associated poor sleep may lead to a vast array of health problems, such as obesity, diabetes, decreased cognitive performance, decreased memory, consolidation, increased fatigue, and so on. The sick and elderly are more susceptible to circadian rhythm dysregulations. And unfortunately, hospital environments are frequently reported to contribute to poor sleep habit quality, constant uniform, artificial hospital light. Does that, even though they try and turn the lights off, the quality of the light is blue, so their minds are already alert and not ready to wake. Thinking about that 90% that I mentioned earlier is that, and most of that time is under artificial lighting, which isn't putting out all those particular qualities. In ancient times, you would have the sun, and then at evening it would be a fireplace, and moonlight. These days we don't experience that dark period in our day at all, and this I feel is a big factor that needs to be. So there's a word called chronopathology. What that means that there are certain diseases that occur in different parts of the day because of that clock that we showed earlier, the different activities our body goes through. So such as a majority of heart attacks occur on Monday mornings, okay, because our biggest spike in blood pressure occurs early in the morning, and Monday being stress day going back to work. So again, there's all these other health conditions that happen throughout the day that lead to reduced mortalities. And so circadian diseases and heart attacks in summertime, there's elevated blood pressure at night, but in wintertime, it's elevated morning blood pressure is the spike. So in wintertime, those heart attacks occur more often than in summertime. Okay, and blood pressure variations, similar thing. So there's that clock that we showed. So 2 a.m. is our deepest sleep. Melatonin levels start 2 hours after the sun's gone down, which is about 9 o'clock. Although with daylight saving, that's been shifted. And then 4:30 a.m., the lowest body temperature. 7:30 a.m. is melatonin secretion stops, and 10 a.m. the highest alertness happens. And again, back to the cardiac problems is there. They did it with 19 countries involved in the study, and as we see, it's the season being summer, wintertime in the middle of the year for us. We have the highest incidence there, whereas in Finland and Canada, that's their summertime, so there's less, and it's in the early months of the year that they get their highest. So we get these variations that happen. And this is just a little bit more of that study, verifying those changes. Okay, there's another word called chronopharmacology. What that is that if you take your medicine at a particular part of day, it will have more effect or less effect. And so this is a study about in the daytime of a asthma drug that was administered. They would get, if they were given it at daytime, it would die off very quickly. If it was given at night, it would be low, but when they really needed it, which is the activity part of the day, it would stay up high. There was also an ABC program talking about cancer. This lady had very severe bowel cancer, and they put her on chemotherapy. And one thing about chemotherapy is what you want to watch is the good cell to bad cell death ratio. And so in her case, there were more good cells being killed by the chemo than bad cells. And so they had to stop it. And then she went to another doctor, and he gave her the same drug, but broke it up to a morning and a midday session, and it was more effective, and wasn't killing anywhere near the number of her good cells. So when we are supposed to take things is very important. So they say calcium and melatonin we should take at night before bedtime for it to have its best impact. So let's go back to our chronotypes. It's the natural inclination of your body to sleep at a certain time, and what most people understand as being an early bird versus a night owl, as we said. In addition to regulating sleep and wake, chronotype has an influence on your appetite, your exercise, your core body temperature. It's responsible for the fact that you feel more alert at certain periods of the day and sleepier at other parts of the day. And there have been some more studies recently, which I'm going to talk about. So chronotype versus circadian rhythms. So sleep chronotype is closely related to circadian rhythm. So those that wake up early are going to have a certain circadian rhythm pattern compared to those at night. And this is dependent on the melatonin levels that are released to the environmental cues such as the light and temperature. However, while circadian rhythms can be trained by adhering to a strict schedule, the underlying chronotype that exists on a more permanent basis, so it doesn't change as much. And this is why the larks can't change as much, whereas the owls do. Okay. So scientists consider it very difficult or impossible to purposely change your chronotype, though it may show throughout the course of your life. When a person's natural chronotype comes into conflict with the demands of the schedule, there is a term called social jet lag, okay, when it's out. And So chronotypes can vary from person to person depending on genetics, at their age, and other factors. And chronotypes may also differ according to geographical locations as well, due to changes in daylight hours. So multiple studies have found associations between chronotype and personality. So this is what your the poll was about, okay? And we'll have a look at that after this. So personality traits associated with mourningness, which is your lark, include conscientious and agreeableness. So they're calm and easily to not stress as much. By contrast, neuroticism and openness to experience are typically related to eveningness. Morning people tend to perform better in school, while evening types may have more of an aptitude for creative thinking. So morning people are more sequential, is one way of thinking of it, and evening people are more global, so they're more out there. Eveningness is also linked to impulsivity, anger, depression, anxiety, as well as a host of negative habits, including risk-taking, skipping breakfast and eating more in the evening, using more electronic media, and use of substances such as tobacco, alcohol, and caffeine. So they're more risk-takers. So there are three types: the morning type, or early morning, intermediate, which are late morning, and the evening type. So there's a study on development of chronotype in adolescence, implication of poor brain development, and psychopathology. So looking at the little graph here, so between 0 and 11 years old, most genotypes are morning. So babies wake up, infants wake up early in the morning. And between 11 and 16, we start to shift to becoming the medium, and then up to eveningness. Evening is associated with an increased risk for psychopathology, internalizing and externalizing behaviors. So internalizing behaviors are like being anxious, depressive, and low self-esteem or withdrawal. External behaviors are aggression, conduct problems in inattention, impulsivity, substance abuse, and antisocial and oppositional behaviors. So evening people are more prone to that. And if we look at our children staying up later and later, they wake up cranky, and you can't, they're more defiant. So the other thing they found was that increase in evening presenters also meant the actual white matter of the brain wasn't developing. So there was a physical change that was happening as well as a psychological behavior that was happening. And so increased the eveningness, this predicted attenuated development of white matter over time, and increased eveningness, this predicted externalizing symptoms. So they were more aggressive, displaying of their dissociated behavior as the eveningness or the owl part of them was coming out. Increased evening, this did not predict internalizing symptoms. So it didn't show that, they were holding themselves in, but they were expressing it out. So in conclusion is a change towards greater eveningness might be considered as a risk factor for a greater externalizing psychopathology and attenuated white matter development over adolescence. And targeting sleep-wake preferences early in development might carry long-term benefits for adolescents' mental health. So the way we help them regulate their sleep patterns when they're young can guide how they're going to perform later in life. And this was a study done last year here in Melbourne, in Victoria. And similar in Melbourne again, chronotypes in sports. So there's a difference in activity of sports. What they wanted to do is examine the chronotype distribution of professional female Australian footballers, examine the impact of chronotype has on sleep-wake behaviour and subsequent perceived exertion and training loads. So did they have more energy during training and the matches? And so they found that the Mourningness 35%, the intermediate were 58%. There were only 9.7% of chronotypes in sport there, because their energy peaks are needed in that training period by the intermediate in the morning, but the evening didn't have it. They'd wear out faster. Okay, so there's a difference there. So our understanding, what we realised is that all of this is controlled by light entering our eyes. And so from a lot of studies in that, what we understand now is that light entering our eyes is that, well, basically we can't see things around us, so we can't move around. But light is the trigger of our emotional responses. It connects us internally. It makes us feel good. It makes us feel more effective. It is responsible for growth. It makes us feel more secure. It provides us with amusement. It's light. It lights our task area. It lights our task area. It is essential to help in care of aged and dementia sufferers. Used for bacteria and germ control, the UV. Light enables us to eat with our eyes. So they're all things that we get from our seeing part, but from our internal light or absorbed light influences vision and perception of objects, our acuity, and there are 3 stages in that. It triggers the hormone production, so internally it produces us with comfort physiologically and gives us energy, aids our health, and it's used in healthcare. In the old days, remember, they used to send them up to the mountains, closer to the UV, fresh air, sunlight, and it's used for water treatments, the UV, and controls our circadian pattern. And as we age, this is going to be affected because the crystalline lens and pupil size vary as we get older. So aging increases crystalline lens light absorption, so it cuts out more of the blue part area, resulting in progressive loss of circadian photoreception, and a 10-year-old child has circadian photoreception 10 times better than a 95-year-old phakic, which means that they're cataract type patients. A 45-year-old retains only half the circadian photoreceptors of early youth. Pseudophakia, that is when they've had the cataracts removed, improves it again. All right. So the amount of light coming in through our eyes from our pupils will vary that, and also the quality of light by the crystalline lens influences that. And these are some of the wavelengths that we're receptive to. So there are changes within our eye that happened in a circadian because of the dysregulation of circadian patterns. Depending on the dysregulation, being advanced or lagging, there are refractive changes. So recent chick studies show that you can change the length of the eyeball, leading to the development of short-sightedness, which is becoming a pandemic by itself. So by 2050, 50% of the population is going to be short-sighted because of these. And even long-sightedness, which is it can be changed by this dysregulation. Most people will have focusing issues and light sensitivity as well as some of the symptoms. Now, as Manish mentioned, that there's optometric phototherapy or Syntonics. It's a form of light therapy using specific light frequencies via the eyes to improve visual functions. And Syntonics triggers the body's endogenous processes to rebalance the autonomic nervous system for recovery. And blues benefits and its detriments are both a matter of timing, and we do that in that therapy when to use those particular colours to enhance the visual functions and byproducts of health benefits as well. So it's a matter of timing when you do these things. So you're going to see things like blue light therapy glasses. We have seen this already in the kids with jaundice, blue light. In 2004, the International Light Commission on Illumination made a statement that in any design of buildings, you had to consider the biological influence of lighting now when you're designing buildings. And so then a new field has opened up in lighting design. So it was no longer just the aesthetics, but also you had to consider the emotional effect of the colours and lighting environment, the physiological impact that the light will have. As we mentioned, you get more of the blues in the day and more of the reds at night. If they're putting more blues in the evening, it's going to change their function and the ecological impact by illuminating our environment and affecting it. So they're part of those. And so they've come up with what's called the human-centric circadian lighting designs. So what you will see is as things come on is your light will start becoming blue in the morning when you go to the office and get brighter white midday, and then goes into your orangey red later in the evening, which is the normal pattern the sun goes through. And so it'll help improve all these other physiological things, your hyperactivity, your concentration, and things like that. And so they've come up with a formula which is called the MP ratio, which works out the comfort versus alertness pattern. We won't go into that, but that's what it looks at. It's the amount of light to keep us awake compared to the amount that we need to see, the ratio. And here's that pattern that I mentioned. The morning is the blues, midday is the whiter blues, and then the warm whites in the afternoons. And as I said, human-centric lighting it's called. As we spoke about, the natural lighting that happens. So there's your sunlight in the noon, evening, we're getting more of the reds. At night, we hardly get any blues at all. It's all red. And sunlight inside. So when we're indoors, we can the windows cut out some of that, and we see there's a huge peak of red if we didn't have the lights on. Okay, but we do have lights. So natural light, sunlight indoors, as we said, and candlelight is your ideal. So there's, as we see, there's no blues here. So we should spend our nights under campfires. And if we look at it with the actual artificial lighting, cool white has quite a bit of blue, so does the fluorescence, and halogen have some in there, but it's at a lower rate, incandescent. They still have some, but nowhere near the intensity of the others. Okay, and so electronic devices, they're constant. They have that all the way, and the only difference is, your laptop compared to your TV is the working distance. Okay, so you don't notice that your smartphone. If you notice, most people with their smartphone, it's no more than 20 to 25 centimeters away from their face, and that creates huge other problems besides the blue effect of it. Also, they're not paying attention to where they're going, and they learn to switch off a lot more as well. Last bit, actually looking at the most important aspects of the light in our daytime. Okay, in the morning, what happens is, we spoke about the obesity aspect. If we go out in the morning sun, there's more UVA in the morning sun. UVA actually triggers your immune system to build it up, so that by the middle of the day, when you haven't got as much of that, any sun radiation that you had would be counteracted by that level of exposure that you had in the morning. And in the evening is the red. So we get the awaking and then the red for regenerating in the evening. So if we look at UVA is greater than infrared in the morning, that's for our alertness. UVB is high in the middle of the day, and that's used for vitamin D production. And sunset UVA is less than infrared, and that is for our recovery. So as we see there. So best practice for good health. Vitamin D and melanopsin are the strongest antioxidants in our body. So going out in the sun to produce our vitamin D, you won't get that in the morning. You only get that in the middle of the day. And so melanopsin is the biggest ones, and that is dependent on your sleep-wake cycle. So you need to go to bed. So both are very strong anti-cancerous hormones in our body as well. They regulate your sleep according to you should regulate your sleep according to your phenotype. You need at least 8 hours or 8 hours a day. Expose as much of your body to the morning sun for 20 to 30 minutes and 10 to 15 minutes in the middle of the day. And you get actually greater benefits for females doing that, as we saw earlier. Room lighting to mimic a firelight from 7 p.m. at night, and intermittent fasting. So I probably exhausted your memories there, but let's have a look at the poll just as going there. So 86% are you like a chicken? You get up in the morning. So look how many people are early risers. Do that, but they also stay up very late. No, they don't. So you're all larks. So you should all be nice and healthy getting there. Okay. Yeah, so addiction to, I'm speaking to the converted, obviously. You're not addicted to electronic mediums as much as the younger generation. That would be totally reversed. Do you use electronic devices late in the night? No. You're all abiding by the rules already. Are you impulsive? Procrastinator. So it's interesting, we've got almost 50-50 here between that. And following from the earlier part, that doesn't fit as much as that, because procrastinators and impulsiveness comes with late night people. So obviously there's something in the environment that's causing you to disrupt you, and it may not be just the light. Okay. I hope I haven't exceeded your brain cells, and I'm open for questions if there are any. If you're all there, are you all there?
I'm here.
Okay.
Hi, Simon. Sorry, it took me a bit.
Of us anyway. We should have had a chat together.
Yeah, I'm still here.
Okay. Good.
That's great. We've got a few questions here. That was fantastic, by the way. Really informative, and I've taken a few notes. There's really quality information there that needs to be digested. But yeah, we've got a few questions, so I'm going to just ask you a few of those. Yep. So some of them you already answered, but okay. Is there a tendency for owls to become more larkish as they age?
No. It's, as it mentioned, it's more a gene control, but you can shift it, but not all the way. You can become, owls have the flexibility to go more worse or better by getting up earlier. So as you notice, the time spans were from 5 to 7 and 9 to 11 or something, and the evenings were 9 to 11 but 12 to 3 a.m. So you can shift it to the 11 and wake up that earlier. So yes, you can shift it, but you won't directly change it. And aging, because of some of those aspects of the visual system that happen, the lens darkening, so cutting out the blue, actually disrupts it. So you're not getting the blue in the daytime to make you more alert, but it shuts out the blue at night, so you tend to sleep more. And this is probably one of the other reasons why you tend to have the midday sleep as well. On top.
Why is that? The midday sleep is why?
Because they cut out a lot of the blue, so melatonin levels are still higher there. Yeah, they're not been suppressed. Yeah.
Mm. And another question, how much sunlight goes through the eyelids, or do the eyes need to be open?
That's a very good question. Depends on what you want to do. Okay. Not a lot actually gets through the lids, but a lot goes through the lid itself, and it's only the infrared area. And that's why when you close your eyes and direct your sun towards the sun, and it's called sunning, and it is a positive process, you see red at first, because the light's passing through your blood vessels through the lids, and that's what you're hitting. And infrared penetrates deeper than blue, obviously. So what you're doing is you're recharging your eye, you're recharging your body. When you do that sunning, your body exposure plus sunning in the morning for 2 minutes is enough to reset the whole thing as well. So it resets your circadian clock in the same pattern. But so you don't get, if you only need even a millimeter of your lid open, and you'd be surprised how much of the world you actually still see.
Excellent.
Yeah.
That's great. Just a question about the moonlight. How much does the moonlight, or does it have any function in the circadian rhythms? I think you did actually touch on that. And I'm curious. I personally like to wear a night mask over my eyes when I go to sleep when it's a full moon, because I sleep better in total darkness. But I wonder how much of exposure to the moonlight is actually useful for some of our, obviously not circadian rhythms, but other rhythms.
Yes, as I mentioned, the way that our lives are now is that we don't experience darkness very often, and it's only for a short period when you turn the light off and go into the next room. Whereas if you look at, our history is that houses were much smaller, so you only spent indoors for eating and sleeping. You spent the rest of the day outdoors, and it was a fireplace, so you had the red there. And otherwise you were exposed to moonlight. And moonlight is enough to shift everything there. Visually, what it does is helps reset your visual cells, because palming, you remember the process of palming that people, that's what you're doing. What you do is when you're palming, you see blackness, but you don't actually see blackness. You got all these flickering lights, which is all the photoreceptors still firing that have been their clocks aren't working right. And what you're doing is resynchronizing it. And that tells the body then, it says, oh, okay, it's not time to see with our eyes, it's time to see with our feelings and internalizing things. So we do need to see that shift in low light in our part of our physiology, and we're not getting that. So you switch the lights off and you go straight to bed. The moonlight aspect is, and it's varying with with that full moon to half moon to no moon. It's the level of light that you have out there isn't very high at all. Okay, it may seem that way because you're perceiving it relative to the background. The actual light level isn't very high. Having total darkness going to sleep is fine, but I think those subtle changes of the evening still regulate different things in our body, which we're we're not sure, because we've got to go through those REM sleep and so on, which is our distressing time. And I think we need a little bit of that. You don't need to cut it all out. It's more the blue end is the key bit. You need that the red for revitalising.
Excellent. Another question, will sunlight affect our biology through windows? I often wonder that while I'm sitting inside or in a car, are we being benefited by that sunlight?
Yes. What happens, the advantage of glass is it stops UV. So when you're in your car, you're getting all the infrared, so it gets very hot. So all you're going to get is the sauna. You're not going to get it sunburnt. All right. So that's all you're doing. And
so you won't get the vitamin D production. You won't get the UVA for the immunity. No. Okay. So you do have to go outside unless you just want the infrared. Okay.
Yeah, unless you want some of the infrared, just to warm you up because you're feeling, cold. But yeah, you need the skin itself to be exposed in the morning. It's not just the eyes. Yeah.
Excellent. And so I made this little comment. I was quite interested when you said, so if someone wants to lose weight, we advise them to get up very early. So have you seen that happen?
Yes, that's what it does. It affects the leptin and what's the other one? I can't remember the other one. But yes, it affects that biologically. You will lose weight without changing your eating habits.
Actually, that's interesting you say that, because I know two women who get up really early while it's still dark, and they go swimming every morning, and they're both so thin. I don't know if it's a coincidence.
They're exercising too.
They're exercising and they're in early morning, very early morning. Yeah.
So they're getting the whole thing. But you don't have to. If you just expose yourself, it'll resynchronize a whole heap of things, that morning exposure. Okay, it's not just your circadian pattern, your whole hormonal system, your metabolic system, all your digestive systems will be altered. You won't get as much of the cravings at night because the system now is getting back to a normal pattern.
So it's an incredible therapy and treatment that's completely free, that so many people don't take advantage of.
So simple.
Incredible.
Those last things that I mentioned, if you tend to do those and eat, a reasonable diet, and you'll find your body will be pretty stable, because you're going to absorb the foods that you're eating properly. You're not going to throw them out, and mentally you're going to be better and alert.
So that goes to the next question or comment. If highest alertness is in the morning and the highest coordination is in the afternoon, is it best to do mental work in the morning and physical work in the afternoon? Is that what you would say?
That's what the research is showing. That the morning is when you do your office work and your physical activity in the evening.
Excellent.
That's showing. Very true.
And I know you answered this in one of your last slides about strategies, but here's another question. What are good strategies to reprogram teenagers or adults to become larks? So is it a gradual thing, or you tell them just to start getting up, force themselves to get up early and throw themselves into it?
Yes. What they're showing is that having red light at night, no blue light, isn't going to shift the clock as well as blue light in the morning. So getting them up early in the morning, or having, now you're getting all this, all the lighting companies are getting into it, where they have the morning light that you sit alongside, that's in your clock, that turns on blue to wake you up, and then as the day goes on, it goes into the yellows. But yes, getting them exposed to a blue light in the morning will shift them. So having LED lights in the morning will start to do that instead of the sunlight. Having their window open, that'll wake them up early in the morning. But yes, you can do it. But the biggest issue is the fact when they're on these electronic mediums, it tends to keep them alert, so therefore they stay up longer. And then that's when they become crankier and harder to control. So getting rid of the electronic mediums that 2 hours before bedtime is very key. But, you know, you have to survive.
That's the hardest task with
that's right.
Teenagers. I think that's probably the biggest, most difficult thing to do.
The hormone system, this part's going to be even twice as hard, you know.
We've got a comment here, Simon. Thank you. Would love copies of the slides, so I'll arrange that. I'll communicate with you and get that out to Leah has asked for that. And another comment, absolutely wonderful. This is from Lynn. Thank you for doing this information and your generous time. So I think in general we've had a really a warm, great response from you. It's so valuable to revisit this information, and you've got great research there that backs everything up, that really pinpoints the need for sunlight.
Yes. What I was thinking about today is if we think about what they used to do in the olden times and we start to follow those paths, it'll be better and easier for us in all ways. Because your whole coping mechanisms is designed on this habitual, these routines that we create, and they're thrown out all the time. And when we don't, that puts us in that fright and flight, and so then we react, and our whole biology shifts. And light is a very good, simple medium that's around us, and it does it for us. So listen to it, and to the seasons.
That's great, and especially important with, I guess, all the virus type of things that are around, and with winter coming on and our need to keep our immunity strong. Listening to that information is so important. So I hope everyone really takes that message in. And
if you look at all the talk now, is vitamin D is for MS, vitamin D for COVID, vitamin D for all these things, and the melatonin is the second one. If we've got those two levels at our peak, we're a winning battle.
The information that I've come across is that synthetic vitamin D and synthetic melatonin is nothing in comparison in its activity or effectiveness as the naturally generated D and melatonin that we make ourselves. So you can't beat that sunlight.
No, you can't. No, nobody knows. That's right. Yes, thank you so much for inviting me. I hope I didn't baffle too many and go on too much, but yes,
excellent.
So yes.
Thank you so much. And yes, we've got a few other comments. Thank you so much. It's been very informative. So, Simon, thanks. We'll put this out and we can share it far and wide. Hopefully lots of people can benefit. And just before we go, is there a website or anything that you wanted to share with us as far as
I haven't got anything.
Work?
The only thing is the College of Syntonic Optometry, if they wanted to learn a bit more about light entering the eyes for visual function, but it's also for general health improvements as well.
And there's a website for that?
Yes. It's the College of Syntonic Optometry, USA. We haven't got one in Australia yet because there are other political issues that happen.
Okay, I'll find that link. Okay, yes. I'll find that link and I'll put it up for everyone. That'll be great.
Yes, thank you.
Okay, so good night. Good night, Simon, and good night, everyone else. Thank you so much.